Hello, I'm Maura Carley, and today I want to talk about what might be happening to Medicare in 2026. Actually, there's so much going on in healthcare now, and often as a result of different issues. So I want to try to be factual in a world of so much drama and misinformation. As I see it, the two main factors going on in Medicare are the fact that Advantage plans, that's the alternative to original Medicare, have been accused of illegitimately adding diagnoses to obtain so much more money from the federal government through chart review, coaching, home visits, all the rest of it. And that's going to be very, very difficult since there's so much litigation and challenges to these practices. If you believe the Wall Street Journal article, at the top of the list were United Healthcare and Aetna in terms of this type of additional revenue. So if you have an Advantage plan through one of those carriers, it would be likely to think that if they're used to getting a source of revenue that's closing to them, they will seek to do it to replace that revenue in other ways. So that's one issue. The other issue is that the Inflation Reduction Act, which passed when President Biden was president, passed without a single Republican vote. And that's the act that vastly reduced the out-of-pocket maximum for Part D, as in drugs. And it's the same issue. When you so aggressively change the benefit and it results in a loss of revenue to these very for-profit companies for the most part, they'll look to make it up somewhere else. And so there were very, very substantial increases in Part D premiums and co-payments and co-insurance that came in for 2025, the first year of the $2,000 out-of-pocket maximum. And so the Biden administration put in a program of subsidies. It was supposed to be 3 years, and we don't know if the Republicans will allow those subsidies to continue. So that's something to keep your eye on in October. Anyone should be looking at their coverage in October as soon as 2026 information is available. And then the other larger issue, of course, is that Part B of Medicare is just so heavily subsidized, of course, as is Part D. And subsidies in healthcare, that's common in the world, but the extent of them is remarkable. So 92% of Americans, according to the government, pay $185 a month for their Part B, which is 25% of the cost. So the rest of it comes out of general revenues. We always see those articles about how out of whack the ratio of workers to retirees is, but we don't see that much about Medicare. But it's the same issue. As history shows, it's very hard to change some aspects of Medicare. So that's all I want to say. Keep your eye on everything. Don't believe everything you read. In a few more months, we'll have facts. All right. Thank you. Take care. Bye-bye.